Hi, my scholars. Welcome to today's class on the gross anatomy of the breast. It's quite a very important organ that is located at the pectoral region. So let's look into that. So first, we must have a definition. So the breast is defined as a modified sweat gland. So it is a modified sweat gland situated at the superficial fascia of the pectoral region. So it is located at the superficial fascia of the pectoral region. It is rudimentary in males. So in males, the breast is rudimentary in males. So but in females, it becomes well developed during puberty. So during the age of puberty, the breast becomes well developed because of hormonal factors. And there's such a rapid growth spurt during this age. And therefore, it becomes more developed in females, but in males it remains rudimentary. But there could be a clinical condition in which there will be increase in the breast mass in males, and that is called gynecomastia, a form of female breast pattern in the male, and that is called gynecomastia. Alright. So therefore, what about the extent? So the breast extends from the second rib, so this rib right here, it's called the second rib, to the sixth rib. So it extends from the second rib to the sixth rib. So it's called the 2 to 6. And that's the vertical extent of the breast. How about the horizontal extent? So horizontally it extends from this the sternum, and this border right here, the lateral border of the sternum. Okay? And it extends upwards to this line right here. So this line is called the mid-axillary line. It's called the mid-axillary line. So horizontally the breast extends from the lateral border of the sternum to the mid-axillary line, while vertically it extends from the second to the sixth rib. Okay. So it is divided into quadrants. So the breast has 4 quadrants. And the 4 quadrants of the breast include. So if we draw 2 lines here as point of references, so I divide the breast into 4 quadrants. So this one is called the upper lateral quadrant, the upper medial quadrant, the lower lateral quadrant, and the lower medial quadrant. So you could also call it superior lateral, superior medial, inferior lateral, and inferior medial quadrants. So always remember that these lines are imaginary. Alright, so the upper lateral quadrant of the breast extends towards the axilla. So the upper lateral quadrant of the breast extends towards the axilla. And the extension of the upper lateral quadrant of the breast to the axilla is known as the axillary tail of Spence. So this is called the axillary tail of Spence. Okay? So the axillary tail of Spence refers to the parts of the upper lateral quadrant of the breast that extends into the axilla. So it was kind of postulated by James Spence, so it's called the axillary tail of Spence. So however, in order for it to get into the axilla, it must pierce the deep fascia. Okay? So it pierces the deep fascia passing through a foramen. And the foramen in which the axillary tail of Spence passes through to enter the deep fascia of the axilla, that foramen is called the foramen of Lange. So this opening right here is called the foramen of Lange. Alright. So the upper lateral quadrant of the breast continues superlaterally and as the axillary tail of Spence and pierces the deep fascia, passes through the foramen of Lange, and gets the deep fascia of the axilla. That is simply the cause. What is the importance of the axillary tail of Spence? Most tumors of the breast are found in this region. So it's very much implicated in terms of carcinoma of the breast. Okay, that is very, very important. So we have the upper medial quadrant, the lower lateral quadrant, and the lower medial quadrant. Okay, and this central conical structure right here is known as the nipple. So we've been able to discuss basic definitions here as well as the location, the extent, and the quadrant. Alright, so it is a modified sweat gland and there are 2 functions. So the breast serves 2 major functions. First, it is an accessory organ of the female reproductive tract. An accessory organ of the female reproductive system. It's an accessory organ of the female reproductive system. Then secondly, it's a source of nutrition. The source of nutrition for the newborn. And those are the two most important functions. It's a source of nutrition for the newborn, and it's an accessory organ of the female reproductive system. So the two major functions of this organ right here. So now, what are the various components of the breast? In order to appreciate the anatomical structure of the breast, we look at it from the perspective of the composition or the components. So the structure of the breast is categorized into three. And they include from outside in. We talk about the skin. We talk about the parenchyma. And you talk about the stroma. So skin is skin. Skin is the outermost covering of the breast, okay? So usually over this area, most of it is usually hairless. And there are two most important structures of the skin that we must know. So one of them is the nipple. So this conical projection is the nipple. The nipple is a conical projection, highly innervated by nerves. So there are lots of numerous nerve endings right there in the nipple. And when stimulated, it can become erect because it contains erectile tissues. So number one, it is conical. Number two is a projection of the skin. Number three, it contains erectile tissues. Number four, it is richly innervated by nerves. Okay, then number five. Okay, in females, usually females that have not given birth, the nipple is actually located at the level of the fourth intercostal space. So usually located at the level of the fourth intercostal space. Level of the fourth intercostal space. But its position may vary with age, as in ground multipara, as well as very old women. So when the breast sags or become pendulous, the location of the nipple is definitely going to change. And in some pathological conditions like carcinoma of the breast, if there's a sort of retraction, there could be a deviation in the exact location of the nipple. So let's take note of that. Alright. So then surrounding the nipple is another region. And that region is known as the areola. Okay? So this is the nipple, and this surrounding region is known as the areola. So this surrounding region is known as the areola. So the areola is the pigmented circumference that surrounds the breast. So the pigmented portion of the skin that surrounds the nipple is known as the areola. So it is very much pigmented and it surrounds the base of the nipple. It contains numerous sebaceous glands. Now, these sebaceous glands, what are their major functions? So sebaceous, it produces sebum. Sebum is an oil. So there are special glands that produce oil. That oil is called sebum. And the major function is to lubricate. So the sebaceous glands actually lubricate the nipple and sort of prevent cracking of the nipple or development of cracks due to different conditions. Okay, so it lubricates the nipple and it aids even in suckling. So the suckling friction does not produce cracks. That is the major function. However, during pregnancy and lactation, these sebaceous glands can become raised, a form of hyperplastic, in order to meet up with the function. And when you have these raised sebaceous glands in lactating mothers or in pregnant women, they are now called the raised tubercles of Montgomery. So you call that the raised tubercles of Montgomery. So the raised tubercles of Montgomery. Important points to note about the areola. So it is the dark or highly pigmented portion of the skin that surrounds the base of the nipple. So number two, it contains sebaceous glands. Number three, The sebaceous gland helps to lubricate the nipple itself. And then number 4, during pregnancy or lactation, these sebaceous glands become very raised, and they are called the raised tubercles of Montgomery, because it was actually described by Philip von Montgomery. So it's called the raised tubercles of Montgomery. Okay, good. These are the 2 most important things you should note about the skin, okay, of the breast. Then the next is the parenchyma. So the parenchyma of the breast is the glandular portion of the breast. It is the secretory portion of the breast. And what does that mean? It simply implies that the major function of the breast, okay, is dependent on what is happening at the parenchyma. So the parenchyma of the breast is simply a compound tubulo-alveolar gland. So the parenchyma of the breast is formed by a compound tubulo-alveolar gland. Because we earlier said that the breast is a modified sweat gland. And what type of modified sweat gland, based on structure and arrangement of the lobules, is actually a compound tubulo-alveolar gland. Okay? So it's going to have a system of ducts or tubules and a system of secretory cells or alveoli. That is why it's called a compound tubulo-alveolar gland. Alright. So this compound tubulo-alveolar gland, that's actually a modified sweat gland, is divided into lobes. So you have tubulo-alveolar glands to lobes. How many lobes? 15 to 20 lobes. So it varies. But the lobes ranges from 15 lobes to about 20 lobes. Then each lobe is divided into lobules. So what you simply have is, you have tubulo-alveolar glands made up of 15 to 20 lobes. Then the lobes will subdivide and give you lobules. Alright. Then the lobules are actually made up of secretory cells. And those cells are known as the acini cells. Those cells are known as the acini cells. And that is what is illustrated here. So in the parenchyma, you usually have numerous lobes. And the numerous lobes are actually broken into lobules. So this is a lobe of the breast, one of the lobes, usually about 15 to 20, that constitute the parenchyma. So each lobe is divided into lobules. So these are lobules. Okay. Then surrounding each lobule are these cells right here. And secretory cells. So the secretory cells that surround the lobules are known as acini cells. So acini cells are the secretory cells that surround the lobules. So what's the mechanism? So the mechanism is that the acini cells sort of produce the milk, okay, and then they pass through smaller ducts and get into the lobules. So from the lobules, they get squeezed into the main duct, and that duct is called the lactiferous duct. So the milk passes through the lactiferous duct. So this right here is the lactiferous duct. Lactiferous duct. Its major function is lactation. So it passes through the lactiferous duct and enters the lactiferous sinus. So the lactiferous sinus is simply a point for the temporary storage of milk during breastfeeding. So temporary storage of milk occurs in the lactiferous sinus. And from the lactiferous sinus, it enters and exits through the nipple. Okay, so this is the nipple, this is the areola, and then you have a section illustrating a lobe, just one lobe. Okay, so I will say within this one lobe, you have so many lobules. These are lobules. These are lobules. And each lobule is surrounded by acini cells. A-C-I-N-I, acini. So the plural form is acinus. Okay? So it's surrounded by acini cells, form of alveolar secreting cells. So they produce the milk themselves. Okay? So once they produce the milk, what happens? Within the lobules, the lobules get squeezed by another set of cells. So the surrounding modified cells that actually squeeze the milk out from the lobules into the lactiferous duct, okay, those cells are called the myoepithelial cells. Myoepithelial cells. So the myoepithelial cells that surrounds the secretory portion of the breast or the alveoli, okay, they contract. Once they contract, they squeeze out milk from the alveolar cells, okay, out of the lobules into the lactiferous duct. So many lobules open into a central lactiferous duct. Then the lactiferous duct will continue towards the periphery and form a dilatation called the lactiferous sinus. So the milk is temporarily stored at the lactiferous sinus, okay? Then from the lactiferous sinus, it gets through the nipple and outside. So this is simply the mechanism. So I've been able to explain what each lobe is made up of. So it's a compound tubular alveolar gland of about 15 to 20 lobes, and each lobe is made up of lobules. Usually the lobules are up to 15 to about 20 as well. And the lobules contain secretory cells that are surrounded by what? Myoepithelial cells. Now, the production of breast milk is not under nervous control, but rather it is under the control of prolactin, and this prolactin is produced by the pars anterior of the hypophysis cerebri. So the hypophysis cerebri has an anterior part and a posterior part. So the anterior part has the pars anterior of the hypophysis cerebri is very much responsible for the production of milk. So it is not under nervous control, okay, or stimulation of nerves. So right here we have lobes. So these are lobes. So these dilatations are the lactiferous sinuses for temporary milk storage, okay, and they all open or converge and open onto the base of the nipple. Alright. So we have some important relations with the breast. So the breast is actually related to some muscles. So the relations of the breast include the following. So we have this muscle right here. So this muscle is known as the pectoralis major. So the breast is related to the pectoralis major. It is also related to the serratus anterior. Then finally, it is related to the external oblique muscle of the abdomen. To the external oblique muscle of the abdomen. So and those are the relations of the breast. Related to the pectoralis major, it's related to the serratus anterior, that muscle with serrated edges, okay? And it's also related to the external oblique muscle of the abdomen. You kind of find it by the side of the abdomen. Very, very important. So we are done with the skin, we are done with the parenchyma. What about the stroma? So the stroma is the third portion of the breast. So literally you have the skin, outermost protection. You have the parenchyma, the bulk of it, the secretory portion. And then you now have a sort of suspensory structures and even supportive framework. So the supportive framework of the breast is called the stroma. So the stroma of the breast is the supportive framework of the breast. And literally it has two components. So we have the fatty stroma and the fibrous stroma. Stroma has the fatty stroma and the fibrous stroma. So the fatty stroma is made up of fat. So it has fat tissues, and these fatty tissues contains adipocytes, okay? And they contribute to the contour of the breast, as well as insulation, as well as protection and cushioning. That's the various functions of the fatty parts of the stroma. How about the fibrous stroma? So the fibrous stroma form a network a supporting network for the breast. So the fibrous stroma is thrown into folds, and you can get those folds right here. So the fibrous stroma is thrown into folds, and these folds are called the suspensory ligament of Cooper. So the fibrous stroma is thrown into folds, and these folds are called the suspensory ligament. The suspensory ligament of Cooper. So the suspensory ligament of Cooper, as explained by Ashley Cooper, is simply the condensation of the connective tissue stroma of the breast. And what do? So they help to suspend the breast, parenchyma, they help to keep it in shape, okay? So they help to support it. So that's the supportive framework for the skeleton of the breast. So the stroma of the breast is the skeleton of the breast, and it has two parts. So the fatty parts that provide the contour, insulation, and cushioning, and the fibrous part that is condensed into strands of fibers, known as the suspensory ligament. And these suspensory ligaments are also called the suspensory ligament of Cooper. Very, very important. So, however, the breast moves freely on the superficial fascia of the pectoral region. Why is it so? It is because between the breast, the substance of the breast itself, and the pectoralis major, you have a fascia. This fascia is called the pectoralis fascia. Okay, so this is the pectoralis fascia, and this is the pectoralis major muscle. Between the pectoralis fascia and the parenchyma of the breast, between the pectoralis fascia and the entire substance of the breast itself is a space. So this space right here is called the retromammary space. So the breast is also known as the mammary gland. So behind, the adjective in anatomy to qualify behind is simply retro or posterior. Okay, so retro or behind the mammary gland is a space. So for that reason, this space is called the retromammary space. So retromammary space. So because of the retromammary space, so the breast can move freely on the superficial fascia of the pectoral region. Very, very important for your MCQs. Okay, so up next, we'll look at the nutrition, the blood supply, the venous drainage, the lymphatic drainage. Very, very easy to understand. So this structure is located on the pectoral region. Okay, so some arteries coursing through there are definitely going to supply it. A simple way to remember the blood supply to the breast is to remember your pia mater. Okay, so the P is for the posterior intercostal arteries. So the posterior intercostal arteries give blood supply to the breast. Posterior intercostal arteries. So another one is the internal thoracic arteries. So the internal thoracic arteries. So usually the internal thoracic arteries are actually larger in the girls. Those branches that are given, those mammary branches of the internal thoracic artery are actually larger in females than in males. Very, very important, okay? So then this artery right here is the axillary artery. So the axillary artery. So the breast is supplied by branches of the posterior intercostal artery, the internal thoracic arteries, the axillary arteries. In fact, some even give a perforating branches that pierces the deep fascia of the pectoral region and goes down to supply the breast. So we should always remember that. What about the venous drainage? The venous drainage usually accompany, these are veins that accompany the arteries. So the veins also include the posterior intercostal veins, the internal thoracic vein, as well as the axillary vein. So arteries, posterior intercostal arteries, internal thoracic arteries, axillary artery. Okay. the veins, posterior intercostal vein, internal thoracic vein, axillary vein. But the difference here is that for the veins actually converge around the areola. Okay, so the veins, they converge around the base of the nipple, close to the substance of the areola. And from this point, they divide into two sets. So we have a superficial set of veins and a deep set of veins. So the superficial set of veins are going to drain every other part of the breast except the nipple and the areola. But the deep set of veins drain every other part of the breast parenchyma, including the nipples and the areola. And this is simply the difference, okay? So while for the arteries, they go down and form a branching network and supply the breast itself. For the veins, what happens? Literally, they converge at the base of the nipple and separate into superficial and deep sets. And this superficial and deep sets then run into the parenchyma and to the skin and supply the various components of the breast. So the breast has a very rich arterial blood supply and venous drainage. Very important. So how about the nerve supply? So the nerve supply is simple. So the breast extends from the second rib to the sixth rib. So definitely, the second to sixth intercostal nerves are never going to neglect that. For the fact that it occupies this region, so you have the second to the sixth intercostal nerves supplying the breast. That's the simple way to remember that. So the breast is supplied by the second to sixth intercostal nerves. By the second to sixth intercostal nerves. So however, it is not all the branches of the second to the sixth intercostal nerves that supply the breast. What are the branches that do that? It is simply the lateral cutaneous branches and the anterior cutaneous branches of the second to the sixth intercostal nerves. So the lateral and anterior cutaneous branches of the second to the sixth intercostal nerves supply the breast. So they innervate the breast. And this innervation is somatosensory. So they are somatosensory innervation. And one thing you need to know is the second intercostal nerve occasionally gives a very long lateral cutaneous branch that could extend into the axilla and supply the skin over the axilla. And that nerve is called the intercostobrachial nerve. So the intercostobrachial nerve would extend into the axilla, supply the skin over the axilla, and also over the medial aspect of the arm. Okay, you call that nerve the intercostobrachial nerve. It is very predisposed to injury in the axilla, especially during invasive surgical procedures in the axilla. So it's very predisposed to injury right there. So it's usually affected. Proper caution is taken to avoid injury to the intercostobrachial nerve if present. But which other nerve is very susceptible to injury? The nerve to the serratus anterior or the long thoracic nerve. So back to the lymphatic drainage. The lymphatic drainage of the breast, okay, is done by lymph nodes and lymphatics. So lymphatics carry the lymph for the breast, so they are the vessels, and they carry them into lymph nodes. So what are the lymph nodes that receive the lymph from the various regions of the breast? So they include the axillary group of lymph nodes. Now, the axillary group of lymph nodes can be remembered with a mnemonic, a clap. So the A is the apical group of lymph nodes. Okay. The C is the central group of lymph nodes. The L is the lateral group of lymph nodes. The A is the anterior group of lymph nodes. And then the P is the posterior group of lymph nodes. So I take it again. So the 5 group of axillary lymph nodes can be remembered with a clap. So we have apical group, central group, lateral group, anterior group, and posterior groups of axillary lymph nodes. Now, the first lymph node that receives the lymphatic drainage, okay, from a carcinomatous tissue. So if you have cancer of the breast right now, and then the first lymph node that receives lymphatic drainage containing cancer cells, that first lymph node is called the sentinel lymph node. Okay? So the first lymph node that actually receives a drainage from a carcinomatous tissue. That lymph node is called the sentinel lymph node. So if the breast is affected by cancer, so you have cancer of the breast, the first group of lymph nodes that will receive lymphatic drainage containing cancer cells is called the sentinel lymph node. That's simply what it represents. Alright. So the breast lymphatics is emptied into the following group of lymph nodes. So the lymph from the breast is drained into the following group of lymph nodes. We have the axillary group of lymph nodes, membrane reticulum. We have the posterior intercostal nodes. The posterior intercostal nodes, okay? We also have the internal mammary nodes. They lie along the internal thoracic artery. The internal mammary nodes. Okay? So we have the supraclavicular nodes. The supraclavicular nodes. So some efferent lymphatics drain lymph into the supraclavicular nodes. Okay? There is also the subdiaphragmatic and subperitoneal lymph nodes. So the subdiaphragmatic and the subperitoneal lymph plexuses will drain into some lymph nodes below the diaphragm, okay, within the peritoneum. So the subdiaphragmatic and the subperitoneal group of lymph nodes. Alright. So these are the lymphatic drainage of the breast. Very, very high yield. However, we have a deep set of lymphatics that drain the breast. So this deep set of lymphatic vessels, they actually form a circle, sort of anastomotic network that drain the breast. And this deep circle of lymphatics that drain the breast is known as the subareolar plexus. It's called the subareolar plexus of Sapi. So the subareolar plexus of Sapi. So the subareolar plexus of Sapi is a deep set of lymphatics that drain deep to the areola. That's why it's called the subareolar plexus of Sapi. So deep to the areola, you have this plexus of lymphatics, actually deep lymphatics, and they drain the breast. Very, very high. So several clinical correlates that we should remember about the gross anatomy of the breast include, so number one, multiple breasts. So supranumerary breast or multiple breast is called polymastia. Okay? Supranumerary nipples, multiple nipples, 2, 3, 5 nipples is called polytelia. So there could be absence of breast. It could be a natural or bilateral absence of breast. That is called amastia. So amastia. So there could be absence of nipples too. That is called atelia. The absence of nipple is atelia, absence of breast, amastia, supranumerary breast, polymastia, supranumerary nipples is called polytelia. Okay, carcinoma of the breast, so cancer of the breast, okay? And when it gets to a very advanced stage, you're going to have this orange-like appearance of the breast. Rotten orange-like appearance of the breast. Now it is called peau de rage, okay? So then, we should also take note that in advanced carcinoma of the breast, there could be fixity of the suspensory ligament of Cooper. There's fixity of the suspensory ligament, so the breast cannot move freely over the pectoral fascia. Very, very important. Alright. So it is important that females of reproductive age that are susceptible or predisposed to cancer of the breast do periodic mammogram. Okay, so mammogram, very, very important, and it has lots of applications here. So the sentinel lymph node is the first set of lymph node that receives drainage from the cancer-affected tissue in the breast. Okay, thank you, male scholars, for making out time to watch this video. Okay, so do well to subscribe, hit the subscribe button, like the video, and share. See you next time. Thank you.